Hello, everyone. Michelle here again from Allegany County Department of Health, and today I'm with Dr. McCormick from Jones. Sir, would you like to introduce yourself and tell everybody why you're here today?
Well, Michelle, thanks for having me. I'm Dr. Kevin McCormick. I'm the medical director at Jones Memorial Hospital, and we've been working hand in hand with the county health department for the last 2 weeks to make sure that the residents of Allegany County have what they need during this crisis.
Oh, that's wonderful. It's wonderful to hear. So a lot of people still have questions about testing. So what are the current guidelines for testing?
So let me just step back one from there, Michelle,
Yeah.
and tell you some of the things that have been going on that people
Perfect.
can't see behind the scenes. Jones Memorial Hospital, as part of the University of Rochester Medical Center affiliate hospitals, is participating every morning in what's called the COVID task force meetings.
Okay.
And this is a meeting of approximately 100 people, and they meet every morning at 8 o'clock. And this is the best and the brightest. And they are trying to anticipate what's going to happen. They are working on what might be next and thinking of the solutions to stay one step ahead. They also are keeping up on the latest information to make sure that those of us out here at Jones and Allegany County, with the health department and Jones working together, have the latest information from New York State Department of Health, CDC, and all the professional organizations. And we're also building on the experience of other health systems through the country who have experienced this before us. So I can tell you that Jones Memorial Hospital in Allegany County, we're ready. We have been planning furiously, everything from where we're getting our gloves to how many ventilators, how many beds, how we can increase the number of beds if needed. We're coordinating with the other area hospitals. So it is the everybody working together that we always hope would happen.
Yes, finally.
It's happening. I'm telling you, it is what you would wish for, and
Yes.
it's happening. Everyone's playing beautifully in the sandbox.
Perfect. And that's been really kind of the cool things, like being able to see it from the health department side is like seeing everything come into place. It's really neat. And I know folks at home don't always get to see that. But yeah, absolutely. I think everybody's playing and creating and doing everything they should, and it's coming together, I think, really nicely.
Well, it's like that old story about the duck that's just sailing across
Yes.
underneath the feet are paddling wildly. That's what's happening
Yes.
through the medical center and through Jones. The Jones staff, I have to tell you, have been fantastic.
Oh, I'm sure.
You know, you had Connor on the other day.
Yes.
And Connor's our infection prevention specialist, and he is just a whiz.
Yes.
And he is in contact with all the people at the university because he's in on the task force call every morning.
Oh, good.
And so then he and I compare notes to make sure we heard all the same things and
Good.
implement it. Yesterday, Connor and Carrie Walker, our human resource director, picked up something that had been sent out for the university. It was just needed a tiny tweaking, and I called up the university and said, "Hold on, we can't put that out yet." And they said, "Yeah, you people down at Jones are really smart."
Nice.
And they made an adjustment this morning so that
Yeah.
it incorporated their feedback.
That's absolutely awesome. So yeah, going back into that testing, who really is getting tested right now?
So that's a great question because, you know, there's been a lot of changing information and
absolutely.
even some misinformation in the media. Certainly not on your website.
No,
No.
never.
Not on these casts. But right now, we're only testing people who are very sick
Okay.
and people who are working in healthcare who are providing care to make sure that they're okay. So if we have a nurse who was taking care of someone before we knew they had it,
Okay.
then that person would be a priority for testing. Okay. Same thing as an EMS worker. Okay. Any of those people who might have been exposed to someone, then they would be high priority for testing.
Absolutely.
Right now, we're very, very happy that we don't have any terribly sick people in our community. We had our last test last night
Okay.
for someone who is in the hospital, who's sick but doing well,
Good.
and that person came back negative.
Oh, good.
And you know, we were able to get that information early this morning because we had to report it to the task force because we're reporting every county and what's going on in every hospital. So right now, don't need to rush out and get a test, okay? If you're not feeling well, if you are concerned, What you do need to do is call your healthcare provider, call their office, because all of our offices are open, okay? They are converting your visits from in-person to telephone, and by next week we hope to televideo, that you'll be able to have an interaction with your healthcare provider that way. If you need to be seen by your healthcare provider, our offices are open and they will ask you to come in. It's a safe place to go, okay? Perfect. We have implemented measures for social distancing in the offices. Perfect. So if you need to be seen, you can be seen and feel safe about it, both in the office and in the hospital.
Oh, that's absolutely perfect. So I'm going to ask you, since you're the expert of everything, why do you think we only have 2 positive cases right now?
Well, it's a reflection of a couple things. We haven't tested an enormous number of residents of Allegany County.
Yes.
But it doesn't mean that we don't have COVID in our community. We do know that it is most likely here, but just as, there's a lot of fish in the pond, and if you put in a fishing line, you don't get them all out.
No.
We won't get them all out.
Absolutely.
And we're only testing people that are sick enough to need hospitalization at this point.
Okay.
So I think it is in our community. It probably is at a lower rate than it is, say, in Manhattan or Brooklyn. Thank
but
goodness.
It's here.
Okay, but it is here, and we expect there probably will be more. So the best thing we can do is not be spreading it to one another. This is not the thing to share.
I understand that. So I've heard a lot of things on social media about people making masks. Is that something that Jones would be interested in getting? Is homemade masks?
So Michelle, another great question. So we think it is really wonderful that people in the community want to help. It shows what the people of Allegany County are like.
Yes.
Okay? Something's happening, everybody wants to contribute. So if people have done that, then we do welcome that. We don't know how they're going to be used yet. Last week, we were afraid we wouldn't have enough masks.
Okay.
This week, it looks good for now, but we have no idea where it's coming. Okay. So that wonderful contribution would be welcome, and we'll figure out how that will fit into our system as things progress. But that's not the most important thing people can do.
What's the most important thing?
You and I both know the best thing that people can do is to stay home and stay tuned to your webcast.
Absolutely. That's what I always tell people.
Oh, but there's another place they can go.
Okay, right here, he's saying go to the Jones Memorial website or onto their Facebook page. So I'm going to make sure when this gets loaded, I'm going to link their Facebook page. Go over there and please like it, because they're doing wonderful things over there, and we want to make sure that you stay connected to them as much as possible. And kind of going in from that, so the wonderful nurses here at Department of Health wanted me to just pass along the message. If you or your spouse are currently sick and are staying home from work, we've gotten a lot of calls about getting cleared by them. The Department of Health is not clearing anybody. Please, again, call your health care provider and call your employer. It should be something that within internal policies with your employer, and that should be worked out through them.
So if you're sick, stay home. Okay?
Yes.
That includes if you have the flu. Stay home.
Yes.
Do not go out if you have the flu.
Yes.
Okay.
Anything. Stay home.
Don't put your neighbors, and your neighbor might be an EMS person or a nurse or someone who works in the healthcare system, so we don't want them getting sick. So stay home, take care, call your healthcare provider's office, which are all open if you need something, and if you need to be seen, you can be seen. Don't worry about that.
Yes, and lastly, well, actually, I will say also, thank you to everybody who is in quarantine right now and in isolation. You are doing such a wonderful job. You are sticking with all the guidelines.
You're being a good citizen.
Yes. I know the family might be driving you nuts, but really, we really do all thank you, because just like Dr. McCormick was saying, is that you don't know who else you're protecting by staying home. So really, thank you. And as always, keep washing your hands, stay away from each other, and we will see you in the next video, right?
Stay tuned.
Thank you.